2024, and I did work with Dr. Snozy a little bit to make sure I had my numbers right, because it's been a little bit of time since I've gone through all this. It's still 795,000 strokes a year are reported just in the United States of America. This is new and reoccurring strokes, because people do go on to have more strokes. It still is the leading cause of adult disability in the United States. Alzheimer's is really kind of picking up the heels as far as that's concerned, but mainly it's stroke that puts you in nursing homes when you're not able to take care of yourself anymore at home. Between 2010 and 2022, and this is very interesting, and this is the hardest group to educate on stroke, the rise in stroke has really increased in males between 45 and 55 years old. And the stress, we'll talk a little bit about that. The stress plays a huge factor. In fact, as I was getting ready early this morning, trying to get everything done, get in the car, because I'm from Yorba Linda, driving over here thinking about talking, thinking, okay, Debbie, just because you teach it doesn't mean you won't have one, so try to conversation. We have a capital campaign going, we have Harvest Festival, we have a meeting upstairs, and they're just like, be careful, Debbie. There's a big shift with why that young generation is happening. Diabetes is a huge risk factor right now that's increasing in our population out of control. Also, stress. It is hard to identify a stress in anybody's life, but we all know when we're under the stress. And stress is definitely a huge risk factor for stroke today. So keep that in mind. Also heart disease. But also know, and I'm going to teach you as we go along with this, 80% of all strokes can be prevented. 80%. I always say as I teach it, if I was teaching you about Alzheimer's and I told you if you do all these things, 80% you won't get Alzheimer's. You would run out and make sure everybody does it, because we fear Alzheimer's. We all do. I lost my mother to it. So we fear it, but I can't figure out how to get people to understand the fear of stroke, because you don't want it to happen. All right. A little bit about women in stroke, because I think Rose asked me to cover that. Just so you know, more women are going to die from a stroke than they are breast cancer. Yes, and we went over all these facts with Dr. Snozy, and yes. More women are going to die from a stroke than they are breast cancer in the United States of America. And that is a true thing. Breast cancer gets a lot of attention. It makes you aware. Again, we fear getting cancer. We fear the word cancer. So we're going to pay attention to that. You can go get screenings to prevent all that, but you can't go get screened sometimes to say, oh yeah, you might have a stroke in a couple of years, but there are risk factors. But just know, again, strokes are preventable, more preventable than breast cancer if we follow the risk factors and know the warning signs we're going to talk about as I go through this. Why is it? We don't know. As we all move through our busy lives and we don't take time for ourselves and we don't pay attention to our blood pressure, we don't pay attention to our risk factors, we're going to increase our risk for stroke. Okay? What causes a stroke? These are controllable risk factors that you all can control every day of your life. The number one cause of stroke today. If you could eliminate high blood pressure or control it, you would eliminate almost 70% of strokes happening today. It is the number one leading cause of stroke today. Yet it's the most treatable disease that is out there today. You manage it. If you have it, you take your blood pressure. You should be taking blood pressure twice a day if you are considered a high risk for blood pressure. If you're on blood pressure medication and you're constantly battling your blood pressure level, you should monitor that blood level, or your blood pressure level twice a day. Best time is in the morning when you wake up. So if you get up in the morning, use the restroom, go back, feel comfortable before you have any coffee or anything like that, the best thing to do is take your blood pressure. The next time you want it, and make sure you write it down because you want to keep track of it. The next time you take it, would be a little bit, maybe an hour after dinner, and you're going to sit relaxed in your chair, not after a walk or anything like that. So you should get a pretty consistent reading of your blood pressure. So blood pressure should not fluctuate a lot during the day. So the meaning to this is, if you get up in the morning and you start your day off with 165/90, we all go through our day and blood pressure rises because it keeps us moving. If our blood pressure is low, we feel very sluggish. So the blood pressure has to rise. So if you're starting off at 165 and you go about your day, within a couple hours you're going to be up at 185. 185/95, which puts you in a risk for having a stroke. If it's continual, it's going to wear down your arteries. Blood pressure is like this with your arteries. It contracts and release as you go along your day. If you constantly contract it and make those arteries strong, they're going to harden, they're going to tear, they're going to bleed, and you're going to have a clot. The second one, and this used to be down quite a bit of a ways, but the second one that is increasing is diabetes. Unfortunately, a lot of us have it. We don't know we have it, and we're not controlling our sugar level in our diet with it. High cholesterol. It's another leading cause of stroke today. So if you've got plaque built up because of high cholesterol, that's going to move, break off from your heart, somewhere else in your body, travel up and have a stroke. Heart and vascular disease, heart disease, you have it, AFib, that has to all be monitored. Smoking is a definite risk factor for stroke. Excessive alcohol use, obesity. I just came back from Italy where everybody walks, because that's what you do. The streets are about this wide. And when they serve you small portions over there. They're not these huge, where you can eat for 3 days off of a meal. So I noticed that they're walking, they're moving. There's not a big obesity factor over there. Even traveling through a lot of Europe. Sedentary lifestyle. If we're going to sit at home and not do anything, it's going to affect a lot of things, a lot of organs, heart, kidneys, everything. Illicit drug use is another thing. Okay. Any questions on the risk factors? Now I'm going to go to about the warning signs of stroke. Again, I'm going to say to you again, remember, 80% of strokes are preventable. Also remember, you're part of USC, you're part of the tradition. You've got wonderful, amazing doctors at Kent. Not just at the campus, but you've got them over Pasadena now, it's going all over, okay? Remember one thing as I go through these with you. 911. I think I'm having a stroke, or I think the person I am with is having a stroke. The sooner you get to the emergency room, the less amount of problems that you're going to have of a deficit after a stroke. These doctors, I've seen them. They get in, they pull out a clot like a dentist pulls teeth out. They do it like in 10 minutes, a clot's out. And it's amazing what they can do, but they can't do it from home. They don't know you're having it. You've got to get in to see them. All hospitals, including CAC, including even all the CAC hospitals around, have a protocol. If they get called in for a stroke, the emergency room is cleared, the imaging room is cleared, all that is taken place, so they can find out what type of stroke you've had. Because as soon as they find out, they can eliminate the problem of more damage to the brain. They can get the clot out if it's a blood clot. They can get the plaque out if it's a plaque. Whatever they can do, they can get and remove that so less damage occurs, okay? The warning signs of a stroke. These are very, very specific stroke, but I want you to understand the first word that you're going to see underlined is the word sudden, because this is what happens when you have a stroke. It's not over time, it's not a day like I've heard, people do. This is a sudden change in all these signs that I'm going to show you. The first one is sudden trouble walking, dizzy, loss of balance or coordination. And it's going to be like we're all right here, and all of a sudden the room might start to spin on you, or you get up because you don't feel like something's right, and you can't walk. You're holding on to something because all of a sudden you have lost your whole way of knowing where your balance is, okay? I always say it's walking like you're drunk, but you know you've not had a lot to drink, but you're walking and you're trying hard to hold on because everything is moving on you. Sudden vision changes in one or both eyes. And this is a sudden change that they note. It's not over time where you have certain issues with your vision. This is all of a sudden you may see black spots or spots that start to appear. You may lose your peripheral vision out of one or both eyes. So holding your hands, all of a sudden you cannot see the side. I cannot see Jane. I used to see her just a few minutes ago, but now all that is disappearing. Again, remember, sudden. Sudden facial droop, facial numbness, all that. If you see somebody that maybe you're having, this was what's happening with Roxana. She was out to lunch with her girlfriend, and her girlfriend noticed that the food was falling out of the side of her mouth. And she was drinking, and everything was not, because the face was drooped. Sometimes they feel it, sometimes they don't. But the best thing to do is, if you're not sure, go smile. If you can't smile, and one part is drooping, it's not common, ever, 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 to have any of these just happen like that to you. Okay? That's a good thing to remember. Sudden weakness in your arms and legs. And it's one side of your body that's going to be affected. So if you can raise those arms high, or whatever you can get them to move, and all of a sudden you're not sure, but one of those hands goes like this, and it goes like this, or the leg goes like this. You were walking fine as you were walking in here, you're moving fine, and all of a sudden, that is a sign that your brain is not getting oxygen or blood to it, all right? Sudden speech, problems with speaking or understanding. And I'll tell you a little story when I'm done with this too, because it's true, it was in the ER. I may be up here talking to you, and all of a sudden I might be talking to you and making no sense at all. But the way a stroke happens and the way it affects the brain is I have no idea what I'm saying to you is not coming out the way I think it is. But you're looking at me like, what is she saying? What is she saying? So you might notice that in someone. All of a sudden they're talking and they're making no sense at all if they're trying to talk back to you. It's a sudden change in their whole way of speaking. And it might be they don't understand anything, like they're looking at you like I'm not comprehending anything that you're saying, all right? The last, remember, time. And if you look up this, because it's a lot to remember, the warning signs, remember, be fast, okay? You see balance, eyes, face, arms, speech. T is for time. Every second you're contemplating what is going on, a part of your brain where that stroke is happening is dying. No, it does not come back. Once it's dead, it's gone. We know now through a lot of great therapists that the brain can tap into the other parts of the brain to compensate for the part that's dead. But what you've lost, you've lost. That's why getting into the emergency room and having the doctor stop that so they can get blood flow and oxygen will eliminate this going into this in your brain. Right? A transient ischemic attack, a TIA, most commonly known as a mini stroke. A lot of people have it. Most people report a TIA or a mini stroke before they go on to have their major stroke. What's going to happen in that is you're going to have one or more of these warning signs. You're going to feel the room spin. You're going to feel the numbness in your leg. You're going to have trouble speaking. You might have a little trouble swallowing or understanding. And as you're going through all this, you might not wanting to call attention to yourself, but you're thinking something's wrong, something's wrong. Maybe 5, 10, 15 minutes at the most, all of a sudden, that clot moves away, blood flow and oxygen remove or go back to your brain, and you feel nothing. So now you're thinking, well, I don't know what that was, but I feel okay now. Okay? Remember one thing if you can today. It is not common for any of these things to happen just like that and then go away. It's not common to not be able to move an arm or a leg. It's not common to have your whole side of your face drop. None of that is common, and then to return about 5-10 minutes later. It should be reported. In most cases, most neurologists will tell you TIA is a 911. You're 9.5 times more likely to go on and have a major stroke from a TIA. It's your body's warning sign saying, something's not right. I'm giving you a few chances to take care of it before I soft punch you with a real stroke. Okay, let's see what you can do. Remember, 80% of strokes are preventable. Okay, 80%. If you go back and you go over the warning signs of a stroke, and you know the risk factors of a stroke. If you've had a stroke, know why you had a stroke. When I still teach, I still do the support group for St. Jude in La Habra. And we get new people all the time, and I always will say, well, why did you have your stroke? I don't know. They never told me. That could be true, but a lot of times when you're having a stroke, the last thing you're doing is a lot of listening to doctors and nurses coming in telling you what's wrong. You're not paying attention. But always know if you've had a stroke or someone that you know has had a stroke, know why they have a stroke. You can't prevent another stroke from happening until you know why you had your first stroke. Have a healthy lifestyle. I know we teach it a lot here in Southern California. We have no excuse for not getting out and walking and moving because we live in a great place. And we don't live in places where you can't get out for days and walk. So if you can, try to get a healthy lifestyle. The key to all this, the key to managing your high blood pressure, the key to managing diabetes, cholesterol, all that is a healthy lifestyle. And it's hard to get people to shift to that healthy lifestyle. But if you can, you're going to keep yourself from having a stroke. And this is all true. Always treat stroke like a medical emergency. Don't wait for your neighbor to come home to take you to the hospital. I hear countless stories of why they didn't get there. Oh, I didn't want the paramedics coming. Everybody's going to want to know what's wrong with me. I'm going to wait until I can get there. So remember, every second you wait, a part of your brain is dying. Okay? The longer it's going to take to rehab and get better with that. All right. In closing, so a little bit on women and knowing that it's not just men old people that have the stroke. And actually, ER, if you remember the program, came to LA County years ago. They filmed over there. Dr. Giannato was over there. And they did a little clip, which was quick, but it really made you, and the way they did it really made you kind of stay with the program and watch it. And it's true, it was their little stab of trying to get people aware, make their awareness of stroke a little bit more. It starts out like we all do, like a little bit like I was this morning. And although I don't have any little kids at home anymore, but I do have a husband. And so the wife is in the kitchen and she's getting everybody off to school. You know, she's got the homework, she's got the breakfast, you know, the horns honking out there for the carpool or the bus. And she's like, yes, yes, yes. Did you get where's your homework? Where's your lunch? And she's getting them all out the door. And they get out the door, the husband comes in and she's, you know, going over things and he said, you know, remember we're having dinner with the Andersons tonight. And she's like, yes, I do. So they're all out the door. She sits down, she has her cup of coffee, and the phone rings. And she goes to answer the phone, and she's like, oh, Jane, oh my God, I totally forgot about the meeting today. I will be there. She goes to hang up the phone. She falls flat. Okay? The next scene, she's waking up as the paramedics are bringing her into the ER. Now, remind you, I told you a little bit about where you could be talking and you're thinking you're saying everything is just fine. And she's probably a woman in her mid-40s, the little kids at home. And they're bringing